Hi, I'm Manuel Lentzen from Fauna for Sky, and I represent to you our project Critical Assessment of Transformer-Based Models for German Clinical Data. The motivation behind this project is the high potential of electronic health records for medical research. We already use structured patient data, but it often lacks patient-specific information, such as descriptions of adverse drug events or environmental health determinants. Mostly, we will find this information in free text. However, as extracting information from free text is challenging, we cannot fully take advantage of the unstructured data. Therefore, clinical concept extraction is crucial for downstream clinical applications, such as clinical decision support. Today's research focuses mainly on deep learning models like BERT. Since BERT was published, more English language models, non-specific and domain-specific, such as BioBERT, have been developed. Nowadays, non-specific German models like GermanBERT or GotBERT are also available, but there are still no German domain-specific models. This study aimed to assess the performance of the existing unspecific models and newly trained domain-specific models for the German clinical domain. Here you can see an overview of the study. First, we compiled a biomedical corpus consisting of drug leaflets, scientific abstracts, and a subset of Wikipedia articles. We used it for the main adaptation of the published GotBERT model and the pre-training of 2 Electra models. Then we annotated 50 discharge letters from the Charité Berlin with the inception annotation tool. We used the labels diagnostic, disorder, dosage, intake, procedure, and medication. And in the end, we fine-tuned the 3 new and 5 published models on 4 datasets. These are Bronco, our new dataset Shadow, GGPONC, and JSync. For JSync, we performed a document classification task. For all others, it was a named entity recognition task. This slide shows the results for the GPONC dataset. You can see the micro-average difference scores on the left. All transformer-based models provided better performances than the existing dictionary and rule-based system. Out of the 8 models we compared, the BioElectra and DBMDZ Electra models achieved the lowest difference scores. Except for GotBERT, which reached an difference score of 0.84, no notable differences were observed for the other models. This also includes the domain-adapted BioGotBERT, which we hope would outperform the non-specific GotBERT. On the right, you can see the entity-wise difference scores, except for the classes devices and physiology. All other classes were predicted with high accuracy. This figure shows the results for the remaining datasets. We found notable differences for the Bronco and Shadow datasets. In both cases, the BioElectra models did not match the performance of the best non-specific models. The BioGotBERT, on the other hand, achieved better results than the GotBERT model on the Bronco dataset. For Shadow, this was the other way around. Here, GotBERT achieved slightly higher performances than BioGotBERT. Overall, G-Electra, GotBERT, and BioGotBERT were the top-performing models in these 2 tasks. And the document classification task on the JSync dataset showed no significant differences between the 8 models. All achieved higher font scores, but the minor variances are not meaningful for the assessment. Now to conclude, as mentioned initially, our goal was to assess the performance of unspecific and newly trained domain-specific German transform models for the clinical domain. Our results indicated that the non-specific models are well suited for the clinical tasks. The GotBERT model, for example, achieved average font scores of at least 0.78 in all 4 tasks. However, we were not successful in developing high-performing domain-specific models. Neither the newly trained BioElectra model nor the domain-adapted BioGotBERT model generally showed more promise than the non-specific counterparts. We assume that this is due to the small corpus available for pre-training. We acquired only 1 GB of textual data, while GermanBERT was trained with 12 and GotBERT with 145 GB of textual data. With larger corpora available, we think that higher performances for domain-specific models are achievable. This was already shown for the English language. The examples are BioBERT or ClinicalBERT. Now I'm nearly finished. I want to show you some references, and I want to thank you for listening. If you have any questions, feel free to contact me.